Today we have 3 speakers. I'll introduce them all briefly, and then I'm going to start off with a few polls to get a sense of who is in the audience, and then Elisa will give her presentation. Elisa recently completed her MPH in Health Promotion at the Dalla Lana School of Public Health at the University of Toronto. During her degree, she completed 2 practica focused on public health policy and child health at the Heart and Stroke Foundation and here at CPHA. Currently, she works in knowledge translation for a food insecurity research program at the University of Toronto, and she'll begin a new role as a junior fellow at the Wellesley Institute in January. Monica graduated from the MPH program at McMaster in 2018, and she completed 2 practicum placements remotely, one full-time in the summer at McMaster and another part-time at CPHA. During her placements, she was able to develop skills in systematic searching, qualitative data analysis, and knowledge translation in health promotion and healthy policy and program research. Her experience will interest those of you looking to demonstrate leadership and project management skills, or if you're considering different working environments such as telecommuting. She will share some strategies on how to develop SMART deliverables and goals during practicum placements. Whitney, our third speaker, is from Edmonton, where she completed a Bachelor of Arts in Sociology from the University of Alberta. She recently graduated with an MPH specializing in Indigenous health from the University of Victoria. During her MPH, Whitney worked as a practicum student with CPHA, assisting with the development of a toolkit promoting the benefits of risky play for children. She's in Ottawa working as a policy analyst for the Public Health Agency of Canada now in the Office of Strategic Policy and Planning. Her role with the agency includes leading the secretariat function for the Indigenous Health subgroup for the Chief Public Health Officer Health Professionals Forum. Now, as I get Elisa's presentation on the screen, I want to ask you where you're at with your education. If you could respond to the poll. Okay, so mostly graduate students or entirely graduate students of those who responded. Okay, so that's really useful. Thank you. Now, when are you scheduled to do your practicum placement? Okay, so there's a few of you, it looks like most of you are not doing this until the spring, some of you starting in winter, and then some later in the fall or next year. All right, sorry, 2020. Okay, terrific, thank you. And lastly, where do you want to do your practicum? Within Canada, internationally, or undecided? Okay, great, thank you. Okay, so that's helpful to our presenters, and we can touch on some of that in the discussion as well. So I turn things over to Elisa now for the first presentation.
Awesome, thank you. So just to start off, a little bit of background experience. Just as Emma mentioned, I completed my Master of Public Health and Health Promotion at U of T and just graduated back in April. And as part of this degree, I completed 2 practicum placements. So one was with the Heart and Stroke Foundation and one was with Canadian Public Health Association. And as Emma also mentioned, I included sort of my current and upcoming jobs here, working in knowledge translation and as a policy research fellow, just to give you sort of a sense of some public health roles that may come after your MPH. And I also wanted to share these just because I think they're a really good representation of applying the type of work I did in my practica to my career today. So it's always nice to see that connection. Moving along sort of into the application process. I started my search for a practicum at the beginning of the semester before the practicum placement. So for those of you who said You'll be completing one in the spring. I did that for my first placement as well, and I began applying in sort of late December, early January. And I would say that that timeline is sort of the most common among MPH students, but it's important to remember that it's something that definitely varies a lot. So if you hear of people sort of finding a placement very early on, don't stress. Every organization has a very different process and timeline, and so long as you're using different sources to look for a placement, whether it's through a program job board or through your own search strategies, you're definitely going to find something. Looking ahead sort of at the actual application materials, my approach when I was applying to placements were to sort of apply to a smaller number of positions with a more tailored and detailed application. So I think it really can set a candidate apart if you make your resume and cover letter specific to the position. So I would definitely recommend, putting that extra time in to make sure each application you send matches very specifically with the type of qualifications that that placement is looking for. And if you do go ahead to that stage with the interview, one thing I would recommend is sort of learning about the organization's work more broadly than just the specific projects of your position. So I can share a bit of an anecdote when I made this mistake with my CPHA interview, actually. So I applied to the position that was focusing, like Whitney, on children's active play and a toolkit around that. And so I learned lots about that project, about the funding, about the literature in that area. And then in the interview, I was asked about another project going on with CPHA, which I wasn't too familiar with because I hadn't prepared more broadly. And I think it's important to remember that as a practicum student, you'll always be supporting, the broad organizational needs, which may go beyond your specific deliverables. So it's great to kind of go into the interview with that impression. And then lastly, one sort of tip that I found really helpful and what I used when looking for a practicum placement is that I looked at public health jobs for the future, like full-time postings. And I was sort of looking at what types of qualifications the employers were looking for in those types of roles, and then seeing how a practicum would match that. So for example, certain jobs might be looking for experience using a specific statistical software, or doing literature reviews, or writing a policy brief. And so if you are interested in those types of jobs, you might want to match that back to your practicum. And then another thing that I really found helpful during the application process, and also even after your placement, was using a competency assessment tool. So this is an image of one here that we used in my program, comes from Health Promotion Canada. But there are many different tools out there, and you could definitely find one that kind of suits your public health area best. But essentially, you go through different sets of skills, and you rate yourself on your competency in those areas. And this can help you kind of see which areas are maybe lower, and so you want to develop in your practicum, but also which skills you feel really confident in, and those you can highlight in your application. And you can also use this type of tool after the placement to kind of measure your improvement and see what the key things you learned in your practicum were. And then going along sort of that process, the next step would be actually choosing your practicum placement. And so these are sort of some of the biggest things that I considered that helped me judge if a role would be a good fit. And so you might consider things like the setting. So for example, do you see yourself working in a nonprofit, a government agency, a community health center? There are lots of different places that, practicums can take place in. You might want to consider the topic of work. So are you going to focus on, a bunch of different projects and topics, or are you going to be more specialized and go in depth on a single topic? And you might also want to consider the deliverables that you would complete as part of the placement. So you might want to think about, are they more applied? Are they more traditional research-focused deliverables? Is there anything that will be public-facing at the end of the placement? And these can all kind of factor into what seems like a good fit for you. And so looking sort of at my experience, there were a couple things that I used that stood out to me in the application process, which helped me kind of get a feel for the positions. So as an example, at Heart and Stroke, one of my supervisors that I learned about in the application process was a recent graduate from an MPH program, and she had actually done her practicum placement in that same role a few years before. And so that really suggested to me that it was a positive experience on both sides, and that she learned a lot to actually come back and work as an employee for that organization. As well, another example for CPHA, I really liked that in the posting they specified that one of the deliverables would be a discussion paper. And so if I kind of compared and contrasted my two experiences, in my first placement at Heart and Stroke, the deliverables were sort of more applied, smaller policy pieces, whereas this would be a bigger discussion paper, and that would really complement my experience while going forward, so that there was sort of something very different about each of these placements. And then kind of making a note of these factors even when you're in the role can be really helpful to informing your career, and it can kind of be a learning experience about what in a job works best for you. So an example here with CPHA, I completed my placement mostly remotely, and during the application process that was really a big draw for me because I had another part-time job in Toronto, I was still taking a course in Toronto, and so that work style was very, very appealing for my current circumstances. But in actually going through and doing that remote experience, it taught me a lot about the type of work environment that I prefer, because I found it very challenging to sort of not get up and go to an office every day, to not, have coworkers around you that you can bounce ideas off of, or not be able to just kind of pop by your supervisor's desk to ask a question. And so it really helped me learn about myself that I get really motivated when, I'm in a collaborative work environment. And so going forward, the types of jobs that I apply to, I look for things that can kind of match that style. And then sort of these are a few kind of tips and tricks that I learned through my experiences and that I would hope to pass along to anyone going into a practicum placement. And the biggest one here definitely to emphasize is don't be afraid to ask questions about pretty much anything. And a good example of how this can kind of pay off is comes from my experience at Heart and Stroke Foundation. And so one of my projects in my placement here was to develop a jurisdictional scan of countries who had policies around marketing to children, so kind of collecting different policies that were going on around the world. And this was because there was a bill under debate in Canada to restrict the marketing of unhealthy food to kids. So they were trying to learn what other policies can inform Canada's policy. And so I heard my supervisor talking about how a senior staff member from Heart and Stroke was actually one of the people who was going to testify in front of the Senate on this bill, and that they were preparing a bunch of briefing materials for him. And so I asked if I could help in that process because from my project I had some of the information in my existing work. And then because I helped out with that, they invited me to come along to the Senate hearings with them, and they were really happy to have kind of a student contributing on this project. And then through going to the hearing, I learned about the Stop Marketing to Kids Coalition, which is a group of organizations doing advocacy on this particular bill. And I heard that they were developing a youth team. And so again, I applied to this, and I ended up working on that team and having another job come out of this big chain of events. So it kind of shows a good example that if you just ask to support a project in a really small way, it can kind of snowball into a much bigger experience that extends beyond your placement. And looking at the rest of the stuff here, I mean, some of them are sort of self-explanatory, but it's really great to initiate feedback sessions with your supervisor so you show you're taking the initiative to want to learn and see how you're progressing through the placement. Definitely try where you can to participate in what's going on around the office. That way you kind of get to know people outside of your immediate teams and you kind of are a bit more memorable from being around. And as well, I think it's really great to keep in touch with your supervisors even beyond the placement, even if it's just to say a quick hello or to share a job update. It's nice to keep that connection going. And then lastly, a tip that I really like doing during my placement is to keep something called a deliverable log. And this is just a place, it can be in a notebook, in a Word document, whatever works for you, where you jot down all of the things that you work on, no matter how big or how small during the placement. And so I think something I took away from doing a practicum is that a lot of the work you end up doing happens outside of your major deliverables. And it's easy to kind of forget a small thing that you work on for a few days and then, 3 or 4 months later when your position is up, it's not always easy to recall exactly what that was. But that experience might be something that is really relevant to a job you apply for in the future, and you might want to market that skill. So by having that explicit list of everything you've worked on, you can kind of go back and reflect and say, oh, maybe I have done that before, or maybe I have engaged with that topic before, and you can kind of pull it out what might otherwise be difficult to recall. And then just lastly, quickly here, going on that train of sort of marketing your practicum experience, I think a really big takeaway from any practicum placement is to identify the transferable public health skills that you took away from it. And, I know in my experience and a lot of fellow students' experiences, some people get kind of stressed that the topic you'll be working on in your placement isn't exactly what you see yourself working across your whole career in that topic area. But I think regardless of the subject matter, there are always going to be these core skills that you're learning that can get carried to most other public health jobs. So a couple just examples here. I was working on one project that focused on a sugary drink levy. And even though I may never work on that topic again, I can now say by piecing apart the components that, I've independently managed a research project from start to finish. I've conducted qualitative interviews. I've engaged stakeholders, and these are all really marketable public health skills. Same with a project at CPHA. It was focused on, very narrowly on the concept of play-friendly cities. But when I do work today in my job focusing on food insecurity, I'm still applying those transferable skills. So writing for a policy audience or synthesizing research. So you can always kind of piece things apart and find out how you can market them in the future to apply to your career. And, no matter what you do, public health is a very diverse field, and there's always going to be ways to pull these skills in. So I think that's all for me, and then I'll pass it back to Emma or along to Monica to present next. Thanks.
Thank you so much, Elisa. That was wonderful. We have time for one or two questions of clarification if anyone has them. You can type them in the chat box. Otherwise, we'll save questions until the end of our three speakers. Okay, I'm not seeing any questions, so we'll move on to Monica. Thank you.
Hi, can everyone hear me? Okay. So I graduated from the Master of Public Health program at McMaster University this year, and similarly to Elisa, I completed 2 practicum placements during the course of my program. Now, if you're wondering why I placed a picture of a pothole as part of my cover page here, it's because searching and completing practicum placement has its own challenges, which hopefully you'll overcome with success after hearing our experiences and tips. So main points I will discuss with you include my experience searching and completing practicum placements, deliverables achieved, things I liked about my practicum placements, lessons learned, my career path today, and tips for you to line up a practicum placement that best fits your needs. So let's get started. When I searched for practicum placements, I wanted to gain experience in healthy program and policy development, implementation, and evaluation. What helped me in my search was to attend a career fair organized by my university program. This provided me with the opportunity to network with various organizations that offered potential practicum placements for students like me. Then I simply took the bull by the horns and started applying to practicum placements that interested me. After interviewing at a couple of places, I ended up lining up 2 practicum placements. One was with McMaster University in the Department of Health Research Methods, Evidence, and Impact. This was full-time in the summer with one of my professors, Dr. Elizabeth Alvarez, leading the development, evaluation, and implementation of a healthy lifestyles program. My work involved conducting research on sleep deprivation and assisting with clinical research tasks, which I will discuss in more details in the next slide. In the fall, I pursued my second practicum placement with Frank Walsh at the Canadian Public Health Association to inform a policy toolkit on unstructured child play similarly to Elisa. This was part-time and conducted remotely, and I was completing my full-time studies in Hamilton at the time. So although both of my practicum experiences were conducted remotely, I took advantage of the space available to graduate students in my department and also took the initiative to visit CPHA for a couple of days when I could find an opportunistic time. In terms of deliverables I was able to achieve, I completed a scoping review on sleep promotion initiatives informed by the application of theories of health behavior. This provided the Healthy Lifestyles program for which I was helping with evidence on strategies to address sleep deprivation in the population. I was able to present this research at 2 conferences this year, including Public Health 2018, which was definitely a good experience, and it taught me a lot of project management skills from start to finish. I also assisted with the development and registration of the pilot study for the evaluation of a healthy lifestyles program, and assisted with a bunch of other research tasks as it was a big research team that I was taking part of. For the Canadian Public Health Association, my main deliverables included a literature review on the relationship between unstructured child play and mental health, which I used to create an infographic on the topic. I also developed a health digest on children's cognitive development and a survey form on promising practices in Canada to improve access to play. What I liked from both of those practicum placements were the flexibility of working at times and locations convenient to my schedule. The topics I was researching were also very interesting. The ability to work on both my weaknesses and strengths, and developing strong project management skills while working independently and as part of a team. In addition, I found both of my supervisors to be honest with my work and enthusiastic about providing me with multiple growth opportunities, which was really motivating. Throughout my practicum placements, I obviously faced some challenges from which I was able to learn. The first lesson that I learned was that distance work limits opportunities. When I visited CPHA's office, I was provided with extra opportunities that I would not normally experience while working remotely. So this was definitely a good lesson to learn. The second was that I learned that the competition for practicum placements is really high. And so it's important to search for multiple opportunities beyond those already created by your program. The third lesson was that original learning plans can change, and it's so important to stay flexible and proactive during this time. For example, I originally intended to develop a database for the evaluation of the Healthy Lifestyles program on top of my other research commitments. But due to project timelines changes and desire to achieve sort of perfection in other areas, I ended up focusing most of my time and energy writing the scoping review, which was not necessarily a bad experience, but just to give you an idea that it's important to try to seek as many different opportunities and skills as you can. So it's important to respect deadlines and plan deliverables while continuing to seek alternative opportunities. Now, in terms of my career path after completing my practicum placements, I gained many valuable skills, including expertise applying theoretical frameworks to conduct qualitative research and health promotion. This makes me qualified for a variety of employment positions in public health, such as research assistant, research coordinators, project officers, health promotion specialists, educators, and so on. So now the big question is, how will you go about lining up a practicum placement that best fits your needs? First, I would suggest attending career fairs and networking. This will help you identify an organization and position that inspires you. Once you have a better idea of the position and organization you want to work with in the future, identify the skills and experiences you need to have on your resume to be a competitive candidate for this sort of position. You can find this information on job postings and by searching current employee profiles on LinkedIn. Then plan for SMART deliverables that you'd like to achieve within 4 months or 2, depending if it's part-time or full-time. And by SMART, I mean a list of projects and experiences during which you will achieve and measure specific results in a timely manner. This will help you stay motivated and organized when searching for practicum placements while building a strong resume. Then apply for as many opportunities as you can and don't be afraid of rejection. Take the time to write cover letters that showcase your passion and learning plan. And don't forget to bring this passion with you during your interviews. Just like Elisa said, make your cover letters personalized. So that's it for my presentation. If you have any questions, I'll be happy to answer them now or during the question and answer session.
Thank you so much, Monica. That was terrific, and you covered some complementary points to what we heard from Elisa. Any questions of clarification for Monica? I do see some questions posted on there that are more targeted to Elisa, and we can get to those during the Q&A. But is there anything specific to this presentation? And while I'm unmuted, Elisa, perhaps you could post in the chat box either a link to that assessing competencies framework that you showed, or the reference for it, since that was one of the other questions. So I don't see any questions, and it doesn't look like anyone is typing, so we will then move on to our third and last presentation by Whitney. Thank you.
Hi, everyone. Can you hear me okay? Okay, so I am going to go ahead and get started. My name is Whitney Wilson, and I've just recently graduated from the University of Victoria with a Master's of Public Health degree specializing in Indigenous health. So I thought I would just give a pretty brief overview of my practicum experience with CPHA, hoping that some of you might be able to benefit or get some better insight into what you might be looking for a practicum experience. Sorry, let me just see if I can get this slide going. Okay, so first, starting at the top, searching for a placement. You'll first want to get honest about your goals and skills. And I know Alyssa mentioned this a little bit as well, but you'll want to know what your strengths are. So you can maximize those by putting them into practice at your practicum. But more important than that, I would put a focus on the skills you want to improve on. So consider things like, do you want to strengthen your writing skills or your research skills? Do you want to work on your interpersonal skills by engaging directly with communities or certain subpopulations? Do you want to learn more about policy or health promotion? I had an interest in Indigenous peoples, as that was my degree. So that was something that I looked for when I was making my practicum applications. Or if there's other minority populations you would like to engage with, or global health, for instance, that was another one of my interests. And also, when you're assessing skills, also take a look at what you want your end goal to be. This was also mentioned by Alyssa, and I apologize, I'll likely echo a lot of the information that has already been said. But yeah, like I said, take a look at your end goal. Where do you hope to eventually work? Do you want to work in the nonprofit sector, or do you want to work with the government or an NGO? And just kind of let that dictate what sorts of jobs you are looking for your practicum. With that being said, though, I would be sure to cast a really wide net. Try to keep as many options open as possible. Organizations are hard to gauge sometimes at first glance. So sometimes a smaller organization can allow you more learning opportunities because they may be more reliant on your work for their day-to-day operations. And not only that, though, consider if you work well with more or less structure. So kind of consider the environment that you work best in. I found that organizations like CPHA have a long history of hosting practicum students, so they tend to have more of a structure in place to aid in the transition. But if an organization hasn't hosted a practicum student before, there may be more gray area, and you might have to be more assertive in navigating the situation or creating a role that's valuable for not only yourself, but also for the organization. And lastly, and this is what was most beneficial to me, is I would consider a placement in a new location, particularly in a location that you may wish to work in the future. So like it was mentioned, I'm from Edmonton, and I got the practicum at CPHA out in Ottawa. So I decided to travel to Ottawa knowing that I might like to work in Ottawa in the future. And it actually paid off really well for me, as I'm now working for the Public Health Agency of Canada in Ottawa. So the application and interview process. I would recommend You focus less on your skill set and more on your enthusiasm and willingness to learn. So a practicum is a super good opportunity to get the hands-on experience in the field, and not every program offers that opportunity. So it's something to be excited about. It's something that I think you should express. I think you should express that excitement to your interviewer. I know for myself, Frank Welsh was my supervisor, and he had mentioned once I got the practicum, he had mentioned that was something that he looks for in people. He looks for curiosity and an eagerness to learn, not necessarily a particular skill set. So I would make sure you advertise that during your interview. And then also, just like any other interview, preparation is key. This was mentioned previous as well, but the more prepared you are, the better. Read about the organization, what their vision and mission statements are, their priorities, and make sure you prepare questions for the interviewer. So that was something that came up in my interview. Of course, they always ask you if you have any questions, but it's important to show interest in the organization, and it's the best way to determine if you are a good fit, not only for the organization, but if the organization is a good fit for your goals and your objectives. So make sure you have those prepared. And then lastly, have faith. Applying for a practicum takes time, and I know, like, as the deadline got closer for me, I was starting to have a little bit of panic and anxiety about whether or not I would even get a practicum. And I know I didn't have anyone reach out to me to secure a practicum until about 2 weeks before my deadline. So I was getting a little bit nervous, but my practicum coordinator at my school was telling me to be patient. So I would just recommend you keep in contact with your practicum coordinator as well, because they are a useful resource, and trust that things will work out. You are a valuable resource, and organizations need help. So ultimately, something will pan out. And then my own experience. So my own objectives, like I mentioned, I had an interest in global health. So I thought my best bet was to eventually, or I guess a goal of mine was to work for an international organization. So I wanted to position myself best in hopes that that might come about in my future. So I thought Ottawa would be a good place to get settled, as that's where most of the headquarters of international organizations are. CPHA I found to be a reputable organization, and I thought it might give me opportunities to engage with international stakeholders. So that's why I chose to apply there. Like I said, I did want to be out in Ottawa as well, so it was a really good fit for me. And also, I know this was mentioned by Monica, I also secured multiple placements. So I had another placement as a backup plan in Edmonton, working for the health authority in Alberta, so Alberta Health Services, working on a project for Indigenous health. So I was fortunate enough to secure 2, and then I had some options, which I would recommend, if possible, to secure as many as you can, and then you get to decide what's your best fit and what aligns best with your goals. And then, like I mentioned, I made the move from Edmonton to Ottawa, so that was a big decision. It was quite challenging. It was exciting as well. And I would honestly say that was the best decision I could have made, both professionally and for my own personal growth and experience. As you can see, it was a long drive across country. And pro practicum tip for everyone: if you are driving east across Ontario towards Thunder Bay and signs say there won't be a gas station for a while, I would believe them. As you can see, I ran out of gas at some point, which was added a comic relief to that adventure. So my practicum at CPHA, it wasn't entirely what I expected, both better and worse. I had a vision of CPHA in my head. I thought it was going to be this giant organization with a wide open office, and everyone was working collaboratively on projects, and just this hub of energy. CPHA is actually a really small organization. I think they said they have 20 or so employees, and it was far less interactive than I imagined, but it does really, really good work. And I think that's where the value came from that I wasn't expecting. It's just that I was really proud to be working at that organization. Like Alyssa and Monica, I was working on the Child's Play project. And I was coming in towards the end of the project and was tasked with writing a discussion paper. Some challenges that arose that I guess I didn't anticipate was that writing a discussion paper every day just was not the best or most conducive environment to my learning style. But again, I wouldn't have known that unless I put myself in that position. Fortunately, CPHA has lots of other projects on the go as well. So I had the opportunity to do work outside of the play project. I was able to make a survey, position statements, work on an infographic, smaller writing projects, some research. And so that variety was really great. But that also brings me to just another challenge that might be helpful to just recognize beforehand, is that having multiple tasks going at once, I needed to learn how to identify my priorities. And so there were at times I felt a little overwhelmed with the work, but in hindsight, I think I could have done a better job at communicating with my supervisor here. I think I should have been more vocal when asking about what was a priority at the time and communicating my feelings about the projects I already had on the go. So I didn't want to say no to more tasks, of course, but my supervisor likely didn't know how busy I felt. So that's something I would recommend, is just being very communicative with your supervisor and just letting them know where you're coming from, so then they have a better idea and they can gauge the workload that they're giving you. And one last thing about a challenge that I guess I ran into was that the discussion paper I worked really hard on never really saw the light of day on the website as I thought it would. So I think that's just something to highlight about managing your expectations. It was a very valuable task to write the discussion paper. I learned a lot about how to write in plain language and what a discussion paper was versus the position statement, position paper. But I couldn't be too tied to the outcome and where I was expecting the discussion paper to go. It was valuable for me and my learning, and CPHA assured me that there was lots to take away from the discussion paper. But as far as I can see, it didn't go on the website like I thought it was going to, and that's just okay. That I just couldn't tie myself to that expectation. I think going in, you just have to really be flexible with those expectations. So how did the experience with CPHA shape my career path? I can say that it has had an enormous effect on where I am now. So I currently work, like I said, at the Public Health Agency of Canada as a policy analyst. And I would not have had that opportunity arise had I not had the experience with CPHA and really just coming out to Ottawa. So not only did I learn the practical skills of how to write more in plain language, like I mentioned, I learned the difference between a position statement, position paper, discussion paper, those sorts of things, how policy is created, as well as how public health organizations operate. So their timelines, their expectations, the vernacular they use, and technical skills. More importantly than that, though, I made professional contacts and just contacts in general coming out to Ottawa like I had hoped to do. So a large part of the benefit of coming out to Ottawa was the experience beyond my practicum. So not only did I make awesome friends and I got to experience a new city, I was able to attend events in Ottawa. So I would recommend, if you have the opportunity, to attend related events where you're taking your practicum, to explore those as much as possible as well. It's a good way to network. I was able to develop confidence and overcome challenges that, of course, come with the territory of moving to a new city and having a new job and meeting new people, and overcoming and pushing through those challenges increases confidence and, of course, improves your feelings of self-efficacy. So if something's making you uncomfortable, I advise that you push against it and you do something, even if you're a little scared and you have some fear. So like I said, I learned a lot about myself, but I also made a lot of amazing contacts. So I will tell you how I came to have my job at FAC. I met someone at my gym who worked for the Public Health Agency of Canada, FAC, and he said he would take a look at my CV. I told him that I was out here doing a practicum. He took a look at my CV, and I didn't actually hear back until months later. I was home in Edmonton, and out of the blue, I had an email from someone from FAC asking if I would be interested in a position. So, like I said, you never know how important the context your meeting will be. So I cannot emphasize this enough. Meet as many people as you can. So tips for students, like I said, network as much as you can. Ask questions. Alyssa mentioned this as well, but take advantage of being the learner. Practicum supervisors do not expect you to know everything, and I can tell you from experience, I wish I would have asked more questions. I think it's easier to ask a practicum supervisor questions than your employer, because your employer actually has expectations for you and your performance. So practicum supervisors, Frank was amazing. I just wish I would have utilized him more as a resource instead of trying to figure it out on my own, I guess. Like I mentioned, have no expectations, go in, be flexible, be adaptable, and just go and enjoy the experience. Learn as much as you can, soak it all in, and you really never know where the experience might take you. So that's all I have. Thank you for listening, and hopefully there is something valuable in there that you can take away.
That was wonderful. Thank you so much, Whitney. And thank you to all of the speakers again. So at this point, we can take questions that are either specific to Whitney and the presentation you just heard, or for any of the speakers. And again, because there might be some feedback to the presenters, I can moderate in terms of who wants to go first, and then we can unmute appropriately. But why don't we kick off with a question that was raised earlier by Danielle, and it was, how do you find out what deliverables were included in your placement? So maybe Elisa wants to tackle that one first, since it was, I think, directed right after your presentation.
For sure, that's a really good question. So I was sort of lucky in that both of the placements that I did, Heart and Stroke and CPHA, they gave sort of a general summary of what the deliverables would be in the actual posting for the placement. So it was really great in reading through to be able to see which sort of portfolios or projects you'd be working on and what some of the example deliverables would be. As Whitney emphasized, I would definitely, not take that as a for sure commitment. You always want to be flexible, and as the organizational needs change, so too might those deliverables. And if they aren't identified in the job posting as those were, that's also a really great question that you could ask during the interview. So to, check in with the supervisor if they have an idea of what the deliverables might be, or if they're not totally sure yet, you can also ask what were some of the example deliverables that a previous placement has completed.
Great, thank you. Monica, do you want to add anything?
Yeah, sure. So as Elisa said, I also was lucky to have sort of deliverables planned already by both of my supervisors, although they're sort of flexible still with my needs and goals. I found both of my supervisors to be very flexible when I wanted to obtain a new opportunity. They're definitely willing to give me tasks that I was interested in pursuing. And for those that don't have deliverables planned by their supervisors, for example, if you're networking with different organizations that didn't necessarily have practicum placement students before, then I would discuss skills and competencies that you have and deliverables that you would like to achieve and say how they would fit the organization's goals. And I'm sure you could come with good deliverables that you would be able to achieve, and that would be both beneficial to you and the organization.
Thank you. And Whitney, I don't know if you have anything you want to add?
No, I think the ladies covered it. I really like what Monica said about just being maybe more assertive in making a deliverable or creating a deliverable that might benefit your ultimate goal. So I think that was important. And I think CPHA would have been really flexible with that too. I know the first placement I secured with Alberta Health Services, they did not have clear deliverables. So that would have probably fallen on me to kind of find something that was valuable for both me and the organization. And I think that would have been a lot more legwork. So just being aware of that ahead of time, like Alyssa mentioned, asking that in your interview would be a really good idea.
Terrific, thanks. And then there was a question or comment from Naveen wondering about what questions you might want to ask the interviewer during an interview, since it is really important to have questions for that point of the interview. Do any of the presenters have any suggestions or ideas? And perhaps we can go in. Okay, Monica, yeah, sure. Why don't you kick off?
I can speak from my experience. I think it depends of the organization, the type of nature and work that they get involved in. Sometimes you can find a lot of information on their website about the current projects and initiatives that are undertaken, and if there's anything that you find linking to the practicum placement description, then you can definitely try to show your interest and then just ask more specific questions related to those projects and maybe previous experiences with students, and if there's any opportunities beyond the practicum placement that perhaps you could take from the placement. Those are good questions usually to ask.
And something I would probably add as well, I would ask the interviewer what skills they're looking for in a practicum student. So what would be a good fit for their organization? So then you can kind of gauge right off the bat whether you fit in well or whether you would be a good fit and whether it would be a valuable partnership. Something I remember asking, and I think it might have caught the interviewer off guard a little bit, was what is the culture of your organization? What's the working environment like? What is the office layout? How much collaboration is there? Those are things that I value in a workspace. So I wanted to be as vocal as I could about, I guess, my own expectations. So some options there.
Yeah, I really would echo what Whitney's saying there about asking. I always ask about the work environment or the work culture, because that can kind of really make or break a practicum placement if that's a good fit or not. And related to that, I also really like to ask for the supervisor to describe their supervisory style, so you can kind of get a little bit of insight about how they work with students and how they see the role of students in the organization and sort of what the interaction expectation is between the two of you, because as a student, you'll be working typically very closely with that supervisor. So understanding a bit more about how they see that relationship can be really helpful to judge the fit.
Those are all really great suggestions. And I will just point out that one of the upcoming webinars in this series, the one happening in March, is on the topic of getting a job in public health, and it will be more focused on not just the job search process and writing a cover letter and your resume, but also the interview process itself. And so some of the discussion that we're having now will also be covered in more detail in March. I don't see any other questions, but I'll just say a few words now and let you type your questions. Please don't be shy. I think we heard some really good points from all three presentations today. I'll just reiterate a few comments that were made that struck a chord with me and that we heard from multiple speakers. So learning about the full breadth of the work of the organization, since even though you might be asked to take on a certain project, likelihood is you'll be asked to work on a variety of other projects as well. To keep a deliverable log, since that will help you take stock of all of the skills that you've learned and got to apply as well in the workplace, to stay flexible and proactive and ask questions constantly. I think that you really do have an advantage when you're in the role of a student, not just being able to ask questions, but also attending events. So that point was made by the presenters, and I think it's really important to reiterate that when you're a student, certain opportunities are there for you that might disappear. So take advantage while you can, and show that you are curious and eager to learn. I really like that point. And that certain skills that you might find yourself using is priority setting, since there's always going to be competing priorities and multiple demands on your time.